This short video is to help guide both the trainee and the designated prescribing practitioner to complete a successful case-based discussion and support the trainee to demonstrate excellence. The discussion should take around 10 to 20 minutes, and then you should allow 10 minutes or so for feedback at the end. The trainee should prepare a case within their scope of practice, a case where they've been actively involved in the patient's care. They should provide a brief overview of the case at the start and describe their involvement in the case and how they demonstrate their prescribing competence. This case overview should help to support the trainee to prepare for their case-based discussion. So every section should be completed. This part 1 should be completed by the trainee, if you can, prior to the case-based discussion. It should include the clinical setting. So is it in a GP practice, in a clinic? Is it a outpatient clinic in a hospital? Is it in a private practice? It should also include the focus of the encounter. So was it a medication review with an incidental finding of a patient with high blood pressure, and therefore that then meant that there was an interaction with the patient about their blood pressure management and starting blood pressure treatment? Or was it a patient presenting with a sore throat to a GP practice? It should include a brief medical history and include any social history. You should include a bit of an explanation of your clinical examinations and the assessments that were used. This can be bullet points. It doesn't have to be wordy because it's just to aid your discussion. It should also include the pathophysiology of the condition, and this should be related to the signs and symptoms that your patient presented with. If it's a patient with hypertension, they often don't present with signs and symptoms, although they can. So you should just talk about the pathophysiology of the condition and what happens in the body. So why does a patient present with high blood pressure? What mechanisms are going on in the body that's causing that? You should then describe the pharmacology of the treatment options that you considered. So if you decided to initiate an ACE inhibitor, what is the mechanism of action? And then try and relate that back to the pathophysiology. So why are you using an ACE inhibitor for that patient? The trainee should be using the pathophysiology pharmacology summary, which is another piece of work which helps the trainee to develop their understanding of the pathophysiology around their scope of practice and help them to identify the key medications that they may prescribe. And they may need to refer back to this to help support them for their case-based discussion. They should also include the rationale behind the prescribing decision and the intervention that they made, and include any follow-up and monitoring. We also ask that you list the resources that they use to support that prescribing decision. So was it NICE guidelines, local practice guidelines, just so we can see that element as well. This section should be no more than 600 words. It's a brief summary to aid your discussion with your DPP. So the discussion, the trainee should present the prescribing case that they've led on to their DPP using that summary. It shouldn't be a discussion based on what the student has written. It is about what the presentation that the trainee does with their DPP. This case can be one that the trainee is completed with a different supervisor, but the discussion must occur with the DPP. So the second part of the case-based discussion feedback form needs to be completed by the DPP. This should not be done by the trainee. So after the case has been presented, the DPP should firstly discuss what the complexity of the case, so was it a low, average, or quite a high complex case, and then grade each of the following areas as either below expectations or meets expectations, covering different areas. So history taking, clinical examination, pathophysiology of the condition, the pharmacology of the treatment, and is it related to the pathophysiology of the condition? The patient's current presentation and comorbidities have been considered, the patient's beliefs and preferences taken into consideration, the treatment recommendations are appropriate, the follow-up and monitoring was appropriate, that the trainee acted professionally, and then an assessment of their overall clinical judgment. For the purpose of the case-based discussion and the summative or the final portfolio, the trainee should submit 2 case-based discussions that meets expectations in all areas, and they shouldn't have any below expectations. So if there are below expectations, it may need a new discussion, a new case, or a bit more detail into that area, and then the case can be rediscussed if appropriate. So then comes back to the feedback. So this again is the section that needs to be completed by the designated prescribing practitioner. So was there anything good? We want to hear about what your trainee is doing well. We want to know, was the consultation good? Was it a complex patient and they've gone above and beyond for this patient? Tell us about it. It's good to know. And then also thinking about the suggestions for development. So is there anything that we can do? Is it about the timing of the consultation? Was the consultation 20 minutes, but actually we need to be trying to do these consultations in 10 minutes. So is it about timings? Is it about the guidelines? Is it about other assessments that need to be done? Is there anything that could be done to help improve and develop the trainee? If there are none, please write none. And then the agreed action plan. So no matter even if the student is doing everything perfectly, there's always going to be an action plan for how the trainee can develop or maintain their prescribing competence. And we ask that you do this agreed action plan using SMART objectives. So SMART objectives are specific, measurable, achievable, realistic, and timely. So if you'd like any more information regarding the case-based discussion, there is a course guide and there's more information on the Blackboard site as well. Thank you.